growing awareness of healthy eating and healthy living, people are drastically changing their lives and becoming more and more health conscious. Often, if a close relative or a beloved family member has suffered a minor or major illness, this can often create awareness in individuals about their own state of health. As a result, people are visiting their GPs more often than before. This increase in GP visits has been recognised by supermarkets who are now offering in-store pharmacies in their larger sites to support the growing demand for patient care and medical advice. In this programme, we talked to Dr Chris Steele, one of the UK's most renowned general practitioners, about the supermarket pharmacies offering healthcare advice and health checks. Then we talked to one of the biggest players in the supermarket arena, offering in-store pharmaceutical products and services.
Personally, I think it's a great idea that pharmacies are offering health checks to the public. You must never forget your pharmacist is a highly qualified healthcare professional, right? They know what they're talking about. You don't have to make an appointment to see your pharmacist. You can see your pharmacist today at some point. They're often open, in the evenings and weekends as well. And the facilities they offer, well, the facilities are increasing. Blood pressure checks, cholesterol checks, diabetes checks, all sorts of basic, simple tests. Now, some of the medical professionals are unhappy with that, saying, that pharmacists are taking this away from the domain of the doctor. But I mean, just think it's the convenience of the patient, having the test done by a reliable individual, and many of these tests are free as well. But, if a patient goes in, has a test from a pharmacist, let's say a cholesterol test, well, you don't just think, right, he's found a high cholesterol, I'll start treating myself and go onto a low-fat diet. You just use that as your first step. Well, the pharmacist found a raised cholesterol, then you go and see your GP, and then he does a repeat test using the hospital laboratory to confirm that that abnormal finding, was correct. So I think it's a great first port of call. Don't change any activity in your life or start treating yourself, but use that as a stepping stone to discuss it with your own GP.
My local pharmacist is always willing and helpful to give me any advice I need, particularly if I'm a bit doubtful of the medicines which I've been prescribed. And he's always willing to jump in and tell me what they're for, exactly what they will do and what to expect for any side effects of such like things as that.
I think the fact that pharmacists are offering these health tests to the public is a great idea. Look, I'm a GP. It doesn't bother me if the public are going to the pharmacy. At least they're having reliable testing done rather than ordering them anonymously from an internet source. You can trust your local pharmacist. And the good thing is, your pharmacist may know you very well, may know your family history very well, will probably know your GP very well. So it's quite a workable sort of environment there with you, the pharmacist, your GP. And I know some GPs aren't happy, saying that the pharmacies are taking this away from them. Hey, they're saving us a job, They're screening people. They're offering, in many cases, a free screening service. Now, they're screening people we wouldn't screen. We haven't got the time. Someone comes in, they just say, I want a blood test for cholesterol. Well, we're thinking, well, why? What's the reason? Are you at risk, etc., etc.? So I'm all for pharmacists testing the public who want to be tested, but then the patient's coming along with their results to discuss it with the GP, and then he decides on the action that follows after that. I encourage people to visit the local pharmacist, and I'm repeating this, I keep saying it again and again to many people, your pharmacist is a professional healthcare individual, highly trained. They've got a good knowledge of medicine, a good knowledge of diseases, and a huge amount of knowledge in terms of treatment of diseases. So they can screen patients, they can test patients, and the tests they offer, they're basic, but vital, blood pressure check, cholesterol test, diabetes check. You don't feel these conditions, you don't feel a high blood pressure, you don't feel a high cholesterol, you don't feel a high blood sugar, so you don't know you've got them. And for pharmacists to offer this testing facility, they could be identifying a lot of people out there with undiagnosed conditions. For example, diabetes. You've got 1 million people walking around out there with diabetes undiagnosed. They've got a very dangerous condition, they've got no symptoms, and I call them the missing million. And how many more are out there with undiagnosed blood pressure, you know, undiagnosed cholesterol? So I think the facility of pharmacists to offer this to the public is an excellent idea, and I'm all for it.
Tesco has been established as a household name and offers consumers a vast range of diverse products and services all over the UK. The introduction of Tesco Pharmacy offers pharmaceutical products along with a range of medical advice and medical services, which fits in perfectly with the busy lives of consumers today. Let's visit a Tesco Pharmacy to find out more.
In Tesco Pharmacies, we have over 310 pharmacies at the moment, operating more than 100 hours a week. We find that this is a great way to provide extended service to all of our customers. Our aim is to provide a customer-centered, world-class service to our customers. Tesco Pharmacies offer a repeat prescription collection service, which is to help customers do it all under one roof. So they don't have to queue at the surgery, they don't have to queue at the pharmacies. The customers can leave their repeat slips with the pharmacies, and we can check what they need and just order exactly the medications that they want. The pharmacy team can take the repeat slip to the surgery and then collect the prescription when it's ready next time they go around. This helps the customers to just order exactly what they want, when they want, whatever day of the week and whatever time of the week that is convenient to the customers. Medicine Use Review is a service, it's a free service provided for the customers to help them understand their medications, when to take them, how to take them, and it's a private consultation carried out with the customer by a trained, accredited pharmacist. The whole point of the service is to help the patient understand their medication. They may hesitate to ask certain questions to their GP because they feel the GPs may not have the time, or the customers do not want to take up too much of the time of their GPs. So a pharmacist will invite the customer into a consultation area and run through all their medications with them, make sure that they're taking the correct medications, and then report back to the GP. The Tesco's pharmacists can advise on health, weight management, on blood pressure checks, exercise and lifestyle changes. And the main one is to help them to quit smoking if this is appropriate.
We've heard from Dr Chris Steele and we've listened to what the pharmacist has to say. Now let's speak to the general public and see what they feel about getting healthcare advice from their pharmacist.
It's open all hours, so I can get a prescription from the doctor even if it's a late appointment and still manage to get my prescription on the same day. And also I can drop off the prescription and then do my shopping, come back to the pharmacy and it's ready for me. There's no waiting around.
When you come to Tesco's, as you're doing your shopping, you've got a prescription, etc., you can get it done at the pharmacy here. Very good.
Parking, it's easier parking in where the supermarket is. High Street, sometimes you have to drive around a couple of times before you actually get a space. That's if you're lucky enough to get one in the end.
As we've seen, the additional products and advice services offered by pharmacies have been welcomed by GPs and the general public. Statistically, people are living longer as a result of maintaining healthier lifestyles. The integration of pharmacies within the larger supermarkets has encouraged otherwise reluctant consumers to become more proactive with regards to their general health. Pharmacy websites are becoming enriched with useful medical information, which allows patients to have more control over their well-being. Pharmacies have moved above and beyond their traditional approach to just offering pharmaceutical products, and that can only be a good thing for the GPs and their patients.